I mean, the smoking study was interesting in that it basically confirmed that yes, a lot of smokers are hospitalized and could be treated in the hospital theoretically. So, you know, as smoking causes cancer, heart attacks, strokes, it seems clear that an intervention could take place at the hospital. But that's not really where smokers smoke. You're not allowed to smoke in the hospital. The real challenge is to help people quit smoking where they live and work in the community. And so I think the real work and the real heavy lifting has to take place where smokers actually smoke and not in the hospital. The study did launch some interesting you know, things to build on, like what next? Now that we know that there are all these smokers passing through the hospital, yes, that could be the first point of contact. When you send smokers out into the world, what can you tell them to do? And there's a few very simple recommendations. The first would be to advise every smoker that you come across that yes, it's not too late to quit, and quitting can reduce mortality related to smoking. So that's the first thing, is just to advise someone to quit. The second thing is medications are effective. Make sure that you at least tell them to try a nicotine patch or a gum or some combination of medications, because they're shown to double quit rates. And the third thing is get some kind of support, whether it's from phone and web-based support like quit groups or quitgroups.com, whether it's going to the local hospital and finding out what community programs they have, or whether it's just going to something like Nicotine Anonymous, or just talking every day to a friend who's been successful. Get some kind of support, because that makes a huge difference. You should be really aggressive in terms of the things that you try, meaning don't just take one thing. Try as many of the options that are affordable and available to you, and use them, because you have nothing to lose by trying. It takes most people 7 to 9 times to quit for 6 months or more. There are a number of web and app-based programs. I think a lot of smokers are not necessarily technologically savvy. That's more and more, but you have a lot of people who are quitting in their 50s and 60s. So although there are some high-tech options, low-tech options like traditional face-to-face therapies, phone-based groups, group treatments are still the standard of care when treating smokers.